mic working? Oh, there we go. Great. At Opeeka, we are addressing two of the most vexing challenges in the $4 trillion healthcare arena. First, we have cracked the code on information sharing so that care teams can work together to treat patients with complex conditions that are driving 80% of the healthcare costs. Second, our AI, artificial intelligence, looks across that data and identifies treatments that are most likely to work. Hi, I'm Dr. Kate Cordell, co-founder of Opeeka. When my son was in 2nd grade, he caught a cold that never seemed to go away, spending weeks at a time in bed struggling to breathe. We saw specialist after specialist telling and retelling his story. We tried treatment after treatment, reporting back on his symptoms time and time again. It took 7 years to find the right treatment. If our care team were using person-centered intelligence, it would have done 3 things. First, it would have brought together the information from all of his specialists and other care providers into a single unified full picture view and a story map of his history that could be seen in a single glance, bringing his needs sharply into focus. Second, it would have pinged us on a regular basis, asking us to report back on changes in symptoms after changes in treatments, so his care team could have been proactive in adjusting his treatment when his symptoms were not responding. And third, our artificial intelligence would have identified what treatments had worked for similar people with similar symptoms in similar circumstances. We launched 18 months ago, and we have 16 care organizations serving 11,000 patients, tracking over 100,000 symptoms and impairments, showing a 1/3 reduction of the reasons that people are going to care. This is already early evidence suggests we're saving $10 million annually in helping patients avoid care that simply wasn't going to work for them. Over the next year, we're moving from hundreds of thousands of dollars in sales to many, many millions, because we are already working to roll out across entire health plans, counties, states, countries, and even kingdoms like Saudi Arabia. We are working to expand our executive team. We have Dr. Jacob Jorgensen here as our Chief Medical Director, and I'm happy to report that my son is doing much better now that he's on the right treatment. We'd love to take advantage of the backyard and get introductions to health plans and care organizations that want healthier populations, because our goal at Opeeka is to make sure that every patient and provider gets to the right treatment faster. Thank you.
Great presentation. Thank you very much. So one of the first questions that came to me is when you mentioned healthcare plans and healthcare providers. I worry a little bit about that sort of the healthcare plan trying to direct the treatment or coverage-wise for the healthcare provider, then it becomes sort of that conflict. So how would you address, or how are you resolving that sort of tension between the entities?
Yeah, absolutely. So with the healthcare plans, one of the things that we do is we offer them a closer relationship with their care providers. And by them offering technology that reduces the time they spend on paperwork and that integrates into their workflow, they're saving them time and money for free, but in return, they are sharing back some clinical information that can then provide a view. Now, it doesn't necessarily provide recommendations. What it does is it says, here's the similar patients, here's what treatments have worked for the similar patients, you decide.
And how do you protect the data or the patient data as far as it,
Yeah, we're like any other EMR to some degree. We're not an EMR, we're an EMR augmentation. So we're, SOC 2 compliant, HIPAA compliant in Microsoft Azure, all of that. And we work with Magellan and, the health plans as well. Mm-hmm.
Thank you.
Yep.
Great presentation, Dr. Cordell.
Thank you.
If I break it down into layman terms, am I correct in understanding that your product is an electronic record for the social determinants of health aspects, the mental and behavioral?
It actually does physical as well, so diabetes patients. It really does work better if there is a behavioral component. It's not going to help for infectious diseases as much. So it's better with an, but it is not an electronic health record per se. It is an augmentation to one. Yes.
Correct. Okay.
Correct.
Great. So I'm seeing that list of customers, by the way, terrific progress for a startup to have those names up there. It sounds like a lot of your customers are and possibly will be public agencies. They're most interested in the challenging patient situations, and I would imagine Medicaid,
Medicaid.
Indian prison healthcare system,
Yep.
VA, some of these would be your potential customers.
Yes.
As a startup, one of the things you may want to think about is the sales cycle for public agencies is excruciatingly slow, and the budgetary fickleness of public agencies it adds another wrench. So you may want to think about how you conserve cash through the excruciating pain cycles. If we enter downturn, some of the budgets may evaporate. So something to keep in mind. I'm really surprised and very happy to know that you have that sort of a database, because my other point would have been that some of the AI engines would need the network effects to be able to deliver the insights, but you already have the data. So kudos to you guys.
Thank you.